So the Democratic debate last night exploded on the issue of health care. I'm going to show you a very long clip here, but it's really important. It's Bernie and Warren versus Biden. I don't think Biden knew what he was getting himself into.
Both Senators Warren and Sanders want to replace Obamacare with Medicare for all. You want to build on Obamacare, not scrap it. They propose spending far more than you to combat climate change and tackle student loan debt, and they would raise more in taxes than you to pay for their programs. Are Senators Warren and Sanders pushing too far beyond where Democrats want to go and where the country needs to go?
That'll be for the voters to decide that question. Let me tell you what I think. I think we should have a debate on health care. I know that the senator says she's for Bernie. Well, I'm for Barack. I think the Obamacare worked. I think the way in which we add to it, replace everything that's been cut, add a public option, guarantee that everyone will be able to have affordable insurance, number one. Number two, I think we should be in a position of taking a look at what costs are. My plan for health care costs a lot of money. It costs $740 billion. It doesn't cost $30 trillion. $3.4 trillion a year, it turns out, is twice what the entire federal budget is. That's before it exists now, without interest on the debt. How are we going to pay for it? I want to hear tonight how that's happened. So as far, my distinguished friend, the senator on my left, has not indicated how she pays for it. And the senator has, in fact, come forward and said how he's going to pay for it, but he gets about halfway there. There's a lot of other things that need to be done. I have a bold plan to deal with making sure we triple the money for at-risk schools that are Title I schools from 15 to $45 billion a year. But I go down the line, and each of the things we're talking about, I lay out how I can pay for it, how I can get it done, and why it's better.
So let's be clear about health care, and let's actually start where Vice President did. We all owe a huge debt to President Obama, who fundamentally transformed health care in America and committed this country to health care for every human being. And now the question is, how best can we improve on it? And I believe the best way we can do that is we make sure that everybody gets covered by health care at the lowest possible cost. How do we pay for it? We pay for it. Those at the very top, the richest individuals and the biggest corporations, are going to pay more. And middle-class families are going to pay less. That's how this is going to work.
Direct question. You said middle-class families are going to pay less, but will middle-class taxes go up to pay for the program? I know you believe that the deductibles and the premiums will go down. Will middle-class taxes go up? Will private insurance be eliminated?
Look, what families have to deal with is cost. Total cost. That's what they have to deal with. And understand, families are paying for their health care today. Families pay every time an insurance company says, sorry, you can't see that specialist. Every time an insurance company says, sorry, that doctor is out of network. Sorry, we are not covering that prescription. Families are paying every time they don't get a prescription filled because they can't pay for it. They don't have a lump checked out because they can't afford the copay. What we're talking about here is what's going to happen in families' pockets, what's going to happen in their budgets. And the answer is on Medicare for all. Costs are going to go up for wealthier individuals, and costs are going to go up for giant corporations. But for hardworking families across this country, costs are going to go down, and that's how it should work under Medicare for all in our health care system.
Senator Sanders, you were invoked by the Vice President. Also take on that question about taxes.
Joe said that Medicare for all will cost over $30 trillion. That's right, Joe. Status quo over 10 years will be $50 trillion. Every study done shows that Medicare for all is the most cost-effective approach to providing health care to every man, woman, and child in this country. I, who wrote the damn bill, if I may say so, intend to eliminate all out-of-pocket expenses, all deductibles, all co-payments. Nobody in America will pay more than $200 a year for prescription drugs because we're going to stand up to the greed and corruption and price fixing of the pharmaceutical industry. We need We need a health care system that guarantees health care to all people, as every other major country does, not a system which provides $100 billion a year in profit for the drug companies and the insurance companies. And to tell you how absurd the system is, tonight on ABC, the healthcare industry will be advertising, telling you how bad Medicare for All is because they want to protect their profits. That is absurd.
Number one, my health care plan does significantly cut the cost of it. Largest out-of-pocket payment you'll pay is $1,000. You'll be able to get into anyone who can't afford it gets automatically enrolled in the Medicare type option we have, et cetera. But guess what? Of the 160 million people who like their health care now, they can keep it. If they don't like it, they can leave. Number one. Number two, the fact of the matter is we're in a situation where, if you notice, he hadn't answered the question. This is about candor, honesty, big ideas. Well, let's have a big idea. The tax of 2% that the senator's talking about, that raises about $3 billion. Guess what? That leaves you about $28 billion short. The senator said before it's going to cost you in your pay. There will be a deductible in your paycheck. You're going to, the middle class person, someone making 60 grand with 3 kids, they're going to end up paying $5,000 more. They're going to end up paying 4% more on their income tax. That's a reality. Now, it's not a bad idea if you like it. I don't like it.
Okay, now I want everybody to keep to the time, but you did invoke both senators. I have to get responses from them, then we will go on out.
Good.
Senator Warren, you go first.
So let's be clear. I've actually never met anybody who likes their health insurance company. I've met people who like their doctors. I've met people who like their nurses. I've met people who like their pharmacists. Met people who like their physical therapists. What they want is access to health care. And we just need to be clear about what Medicare for All is all about. Instead of paying premiums into insurance companies and then having insurance companies build their profits by saying no to coverage, we're going to do this by saying everyone is covered by Medicare for All. Every health care provider is covered. And the only question here in terms of difference is where to send the bill.
Senator Sanders.
Let us be clear, Joe. In the United States of America, we are spending twice as much per capita on health care as the Canadians or any other major country on earth.
This is America.
Yeah, but Americans don't want to pay twice as much as other countries. And they guarantee health care to all people. Under my Medicare for All proposal, when you don't pay out of pocket and you don't pay premiums, maybe you have run into people who love their premiums. I haven't. What people want is cost-effective health care. Medicare for All will save the average American substantial sums of money on his or her health care bill.
My favorite part of that was at the end when Bernie Sanders is bringing up relevant facts to the debate. He's like, Americans are paying twice as much as the rest of the developed world. And Biden's response is, this is America. What? Okay. And then, so are you saying it's good that we pay twice as much as the rest of the developed world? And we don't even cover everybody in the process? Dude. Joe Biden is flat out in over his head. I mean, that was brilliant. Brilliant. Now, it's a fair question to say, well, how committed is Elizabeth Warren truly to Medicare for All? She just released her own plan the other day, and there are giant question marks. She doesn't use the phrase single payer at all in her entire bill, and she uses the weasel words access to health care. So, is she fully committed? It's still an open question, man. It's not, I'm certainly not 100% convinced that she would fight for it like Bernie would fight for it, okay? But let me digress from that, because for the purposes of this conversation with that exchange we just watched, they were a brilliant tag team. I mean, they just obliterated him in 30,000 ways. So, of course, the first thing that comes up, because these people are fundamentally incapable of listening, digesting a point, and then self-correcting, is the cost. How much is it going to cost? How you pay for it? How you pay for it? How you pay for it? How are you going to pay for it is now officially the dumbest response to Medicare for All because it's been sufficiently answered about 1,000 times. The answer is we pay for it by eliminating the private taxes that you're paying to rapacious mafia-like for-profit middlemen and raising the public taxes. But you still save money. Understand? So when we eliminate the private tax and we raise the public tax, you still save money because the private tax was more than the public tax will be. Full stop. So when you say how are you going to pay for it, no. The real question is, how are you going to pay for the status quo? Because that is unaffordable. So I'm so sick of that shit. And then notice, see, this is how you know they're ideologically committed. George Stephanopoulos with his framing in the middle there. He's like, okay, I know you want to eliminate premiums, copays, deductibles, and I know it's going to save everybody money, but will middle-class taxes go up? You know why they do that, right? They just want that soundbite because they want to take it out of context. Will middle-class taxes go up? And then if you say yes, that's it. They won't give the rest of the context, and 1,000 articles will be written that'll say, Bernie Sanders and Elizabeth Warren, yes, I want to raise middle-class taxes. These people are smear merchants, guys. They have an ideology, and they're pushing for it. So it's utterly disgusting because, and this is why, by the way, I favor my framing on this issue, because it's the only way to get out of that trick. That's the only way. When they ask you, are you going to raise middle-class taxes? You go, no, I'm not. What do you mean? How are you going to pay for Medicare for all? Well, if I eliminate the private taxes, which are more, and I raise the public taxes, I'm saving you money. So I'm not raising taxes because I'm eliminating the private taxes. So you could just answer no and then explain it. You deny them the soundbite when you say it that way. Because if you say it any other way, yes, that's it. They got you. Because they're gonna take it out of context 100%. And I love Biden bragging about like the most you'll pay out of pocket is $1,000. That's a lot of money, dog. That's a lot of money. What's the statistic? I forgot. It's like more than half the country can't afford a $500 emergency. 76% of the country is living paycheck to paycheck. Any casualty is like, $1,000 is the most you pay out of pocket. That's not something to brag about. And then Biden just flat out lies because he says, they'll pay $5,000 more. No, they won't. They'll save money with Medicare for all. See, what he's doing is saying, if you add a Medicare for all system on top of our current healthcare system, so in other words, don't reform our system, just add a whole new healthcare system on top of our system, then it would cost you $5,000 more. But that's not the way it works. That's not the way it works. Oh my God, they're so disingenuous. But again, my favorite part by far is Bernie's like, we pay twice as much as every other developed country. And Biden's like, this is America. Was that supposed to be a point? Because it's not. It's really terrible, and it makes you look as out of touch and incoherent as you are.